The results from the surgery are that he is cured from the cancer.
CU Buffs coach Prime announced this week that he had bladder cancer. It was found during a routine scan. Yesterday, he joined his doctors to push others to do their health checkups. And joining us now, Dr. Janet Kukreja, the director of urologic oncology at CU Cancer Center. They call you Dr. K, so I'm going to stick with that. That's a tough name.
That's perfect.
Okay. You shared some video, the CU Cancer Center did, of this robotic treatment, this technique that you use for bladder cancer. Tell us about it and how it works. It sounds amazing.
Yeah. So what it does is it allows us to do a laparoscopic surgery. So when we're doing this surgery, we're in the pelvis, and because of the pelvic ring, it's a very tight space. And so with this, we're able to get in there and do a very fine surgery with little blood loss. The outcomes from this are the same as making a big incision as far as cancer goes. And so when you have a surgery that you can do with exact precision as well as have better outcomes, it's a kind of a no-brainer.
That's incredible. And we know that, HIPAA laws and everything, you can't talk about Coach Prime, and that's fine because this is actually a fairly common cancer. And I've read a little bit more about what you all do, and specifically you, because you are one of the best in the country. And this word cure with that, you just don't hear that often when it comes to cancer. Can you actually say cure after something like this?
Yeah, I think that's a great question. So it really depends on the type of cancer that somebody is coming in with and what the stage is. And really, it's very broad spectrum. So bladder cancer is very common, but there's all different kinds of bladder cancer. And so when you have a bladder cancer, that you have a narrow window sometimes to say that word. And it is a very powerful word. And, I don't use it. I said it yesterday and I'll say it again, like I don't use it lightly. But yes, you can cure this cancer. And not everybody needs to be cured. Some of them are very slow growing and they don't need aggressive treatments like this. But there are some that are aggressive and you get excited when you still use that word.
Absolutely. And we know some of them are high risk. And when they're diagnosed, the options are slim, but you want to be able to cure them. When you have a high profile case, you do raise awareness. Specifically, I think about a cancer, when you think about, not everybody wants to talk about colon cancer. People don't want to talk about bladder cancer, things like that. This is an opportunity too. So educate us. How do we get screened? What do you wish people knew about bladder cancer?
Yeah, so I think that's a great question. And so I love that we're raising awareness for it. And I deal with several sensitive cancers, so prostate and bladder, top cancers for men for sure. So bladder cancer, I think the one thing that I would love for people to know is that blood in your urine in the absence of infection is never normal. So if you're seeing blood in your urine and you don't have a urinary tract infection, you need to get with your primary care doctor and get to a urologist right away.
Well, thank you for that. We hope to continue to raise awareness. Dr. K, thank you so much. And the CU Cancer Center, it also shined a light on the great work you all do. So we're thankful for you and keep doing the good work. Thank you.
Thank you. Thank you so much for having me.
Thank you.